This lecture will discuss the ideas set out by Thompson and Bynum in Juvenile Delinquency, 8th edition, for thinking about juvenile delinquency as an issue that needs treatment and prevention rather than punishment. The philosophy driving juvenile court proceedings has been rehabilitation for most of the existence of the juvenile court. Rehabilitation is usually based on the assumption that the problems are a symptom of some bigger problem that we have to correct, cure, or fix. Delinquency is thus looked at like a disease, one that can be cured given the right treatments. Sometimes jail can be used purely for confinement, but, at least in theory, juvenile detention centers are seen as rehabilitation programs, not storage containers. Juvenile hall is sort of a hospital or rehab center, or at least is intended to be. One possible treatment method is behavioral modification. Behavioral modification programs often work on a demerit or leveling system. Behaving well earns you more privileges. Acting out reduces or takes away privileges and incurs punishments. Although it may work, it is labor and time intensive for the people who are supervising the juveniles, requiring pretty much 24/7 monitoring. Appropriate punishment for youth is also an up-in-the-air kind of thing. We're not sure what works with all juveniles, or even if such a thing exists. Some juveniles may see a particular punishment as fun or as notches on their belt. Some may not even respond to the rewards offered. Negative reinforcement or punishment can also bring up civil rights and inhumane treatment issues. Now, to give an example of the problems with behavior modification, in the movie Dead Poets Society, which is set in the 1950s at a boys' college prep boarding school, there is a point where the class clown acts up to a point beyond what the administration can overlook. This was at a time when corporal punishment in schools was very common. The headmaster, the principal, brings this boy into his office and says, "You're going to tell me who was in on it with you," and the boy says, "No, I'm not," and the headmaster says, "Fine, then assume the position over my desk." The boy then has to place his hands on the edges of the headmaster's desk and stand there with his rear end out. The headmaster begins spanking him with this huge paddle and hitting him hard and making him count the swats. Then he demands information. "Who did this with you? I want names." About 20 seconds later, in the next scene, you see this same kid, the class clown, sitting on several soft pillows in the boys' lounge room in the dorm, bragging about how he didn't let the headmaster get any information out of him. So the deterrence attempt, the beating, didn't work with him. The negative reinforcement did nothing to make him less deviant. Instead, he saw it as a notch on his belt. Ha! I stood up to the administration again and told that headmaster where he could go. I'm better than him. I took it. I'm a man. Look at me. So negative reinforcement can create a reward that wasn't intended. If the reward is just something like, if you behave well, you get to stay up 15 extra minutes at night, and you're 17, you'll probably say, that's not a reward, that's nonsense. Why would I care about that? So behavior modification, while it sounds great in theory, is really more on the level of putting a teen into a cage with an electrified floor and zapping them anytime they get out of line. That's not a humane treatment by any standard. The second possible method is reality therapy or choice therapy. This kind of program focuses on making the individual understand the consequences of their actions and accepting responsibility for them. It does not allow use of the past for excusing current behavior. Reality therapy directly attacks the neutralization techniques that Sykes and Matza identified and forces youth to accept responsibility, even though there might have been excuses or extenuating circumstances. The pros of this method is that it's been used widely by juveniles in many different settings. It's often used in combination with restitution work to the community, which is known as restorative justice. Another thing is tough love, which only deals with behaviors, not feelings, and emphasizes responsible action over excuses. Some programs will even get down to the nitty-gritty of responsibility, including getting up on time, going to bed on time, learning how to shop for necessities and care for the self, as well as responsibility for crimes committed and harm done. Please watch the two videos linked here, and then come back to this video. The first is a video on the pros of reality therapy, and the second is a video on the cons or downsides of reality therapy. Although these programs look harsh, they do report moderate success. Research has also shown, however, that expecting kids to think through their actions may be biologically unrealistic. A third alternative is regular therapy. Group therapy is popular but not necessarily effective. However, therapy for juveniles is often used to try to help them understand why they did what they did, so they can avoid doing it again. These programs look at juvenile delinquency as an individual problem, not a group or structural problem. This means that they tend to ignore the social issues that often push kids into delinquency. The linked video on this slide also documents that many children in the justice system have mental health issues. Although therapy can help with some of these problems, many of these issues are beyond the scope of therapy. They may also need medical and medication treatment. So we have a prevention ideology that often shows up in juvenile corrections and treatment. And what we're trying to do here is identify the kids at risk for delinquency as early as we can. But we even have risk factors for pre-delinquency. A risk factor is something that makes it more likely that a person will end up becoming a delinquent. So here's a list of risk factors for delinquency: alcohol use, bad temper, cheating, neighbor complaints, cruelty to people or animals, being destructive, discipline problems in school, being discourteous, being disobedient, drug use, fighting, hanging out in bad reputation areas, being inconsiderate or irresponsible, a lack of friends, law violations, losing or gaining large sums of money, lying, moodiness, poor grades, running away, regularly missing family meals and other get-togethers, secrecy, sexual misconduct, smoking, staying out late, stealing, swearing, threatening family members, truancy, and verbal abuse. Some of these, such as stealing and law violation, are of course more serious than being discourteous or moody, but all of them are possible indicators that a child is on the path to delinquency. To this point, everything we've discussed has taken a psychological approach. Now we'll discuss some sociological or quasi-sociological approaches that have tried to fix, or at least examine, the problem of juvenile delinquency. CAP, or the Chicago Area Project, looked at the lack of informal social control in mid-1950s Chicago. CAP was focusing on revitalizing social networks in the community. Gangs would be brought into project headquarters and told, hey, your job is to help the community to restore and organize recreational activities. It didn't get rid of delinquency, but it substantially reduced it. It was criticized for being too tolerant of the delinquents and not paying attention to workers' expertise. However, it did serve as a jumping-off point for other community-based programs in other communities. The Mid-City Project, or MCP, aimed at lower-class slum neighborhoods, trying to revitalize the community and the family, and to reduce gang activity. It was not quite the same as the Chicago Area Project because it was run from outside the community, and it was expected to take 3 years. Another difference was that it relied heavily on therapy and counseling, which are psychological, not sociological approaches. The problem is that it did not reduce law-violating behavior, although it did improve school performance. Mainly, it demonstrated that juvenile delinquency is a many-pronged problem. The MFY, or Mobilization for Youth, was set up in Manhattan, and it was an attempt to apply Cloward and Olin's theories about differential opportunity to stop delinquency. Unfortunately, it did not work because the community resisted its implementation. However, this was still a sociological attempt to solve a social problem, and it showed that it isn't just the actor, but his surroundings that matter in solving delinquency. The Minnesota Youth Advocate Program, which later became the Urban League, was school-based in the early 1970s and aimed at helping youths transition back into regular school from correctional facilities. It was also sociologically based, and it saw that it wasn't just the juvenile who needed help adjusting. Parents, schools, and communities also needed help. It eventually gave way to the Urban League, which still sponsors youth programs for youth of color who are considered at risk of violating the law. The Neighborhood Youth Corps in Cincinnati and Detroit was intended to provide vocational training and job opportunities to disadvantaged and delinquent youth. But when compared with control groups, it was shown that the youth who participated showed no difference in recidivism or delinquency rates. In other words, the program really had no effect. There's a lot more to helping youth than simply job training. It has to be a holistic, sociological approach to really do the job correctly. The Highfields Project took delinquent boys into facilities and tried to train them to be non-delinquent, but it didn't work. Recidivism dropped only marginally, and their attitudes, values, behaviors, and personalities remained the same as when they were first delinquent. The Provo experiment tried to use peer pressure to cause delinquents to question their belief systems and enforce conformity, but like Highfields, it wasn't very successful. The Mill Creek Youth Correctional Facility used positive behavior modification techniques to get the boys to change their behavior, and these were very dangerous and violent juveniles. They found that although they still had recidivism, the rate was lower and the offenses less serious after the program. The Paint Creek Youth Center works with male offenders who've committed felonies, trying to teach them some of the life skills, values, and problem-solving techniques that we think might help. But it's shown that it doesn't work. There's almost no difference between boys who have been through the program and those who have not. Project New Pride in Denver, Colorado, works to integrate hardcore juveniles between 14 and 17 years old back into their communities and make them productive members of society, offering help not just to the juveniles, but to their families. There has not yet been a determination on whether it was effective. Private mentoring programs use a Big Brother type of approach and have been shown to reduce recidivism and other problem behaviors. In fact, Big Brothers Big Sisters is one of the best known of these programs. Now, some of the findings of these various approaches show it's not the youth alone or one skill set that's lacking, but a huge number of problems that all have to be addressed. Social skills, personal skills, positive role models, supportive relationships and networks of adults who can provide social control, job training and education, family intervention, professional assistance in developing life skills like personal care and job hunting, and all sorts of other issues. One psychiatrist can't fight that entire phalanx of problems. We need to put a system in place to deal with all these issues, and we just don't have that yet. As for the programs that worked, they still require funding to keep going. The more problems that have to be addressed, the more funding will be needed. Community mobilization is another issue in handling and preventing juvenile delinquency. Citizens can call hotline phone numbers and report criminal activity. Many communities have these programs and offer small monetary rewards for information leading to arrests. This is called pseudo-vigilantism, citizens informing on each other. Neighborhood Watch and Youth Crime Watch programs both draw on youth knowing a great deal about what's going on in a community and including them in the patrols. Neo-vigilantism is when private citizens create private patrols. These are not the same as Neighborhood Watch programs because there is no interaction with police with these groups, and they often cause major problems for police investigators through their interference. SHODI, Serious Habitual Offender Drug Involved, is an attempt to monitor youth offenders and keep them from reoffending. It's almost harassment, according to the juvenile's lawyers, but law enforcement insists that it's actually working to prevent recidivism. Gang intervention programs are often organized like the Guardian Angels and modeled after groups like Mothers Against Drunk Driving, but in many places like Orange County, California, and New York City, New York, law enforcement is included in the attempts to bring down gang activity and increase community-based intervention with gang members. Some studies show that it's bringing down gang activity, but others don't, and the results are not conclusive. Like the attempts at sociological intervention, these programs show that gang membership and delinquency is not just one thing or just one trait. It needs to be addressed with all the major institutions of society and all the major components of any criminal actor's surroundings, not just him, in order to be effective. Overall, what this shows us is that the medical model is not adequate. It does not take sociological factors into account at all. However, programs that also attempt to address these problems have some success. Those that involve the entire community have the most success. It's still not enough, however, and it can be costly and time-consuming for no certain outcome, so many policymakers consider these programs a waste of time at best, and a waste of money at worst. This lecture has outlined Thompson and Bynum's discussions of the main issues of treatment and prevention of juvenile delinquency.